My subspecialty is addiction psychiatry, and that's primarily substance addiction, but it can be addiction to non-substance things such as gambling as well. The specialty primarily deals with people with drug and alcohol dependency, and they tend to have quite chaotic lives. There is a degree of randomness and chaos to my everyday life. People will tend to turn up late, not at all, and they can be quite demanding when they do turn up. They can be intoxicated with substances, and that can affect the way they present to you. There's a fair amount of randomness and chaos to the day, which is entertaining if you're that way inclined. One thing that makes addiction psychiatry different is that there is an enormous variation to not only our average day, but also the people we see. So you can see people, young people who have started using club drugs, for example, right through to consultant surgeons. And it's quite interesting to tease out exactly what substance people are using. And these days, people don't often know what they're using. As with every job, there are pressures, and sometimes it can be overwhelming. So the chaos, which is quite fun, can sometimes be quite draining. Something that makes it slightly different from psychiatry is that you are very much empowering people. There is less. We don't use the Mental Health Act, for example. It's a specific exclusion. So therefore, we must get alongside people with substance disorders and empower them to make changes in their life. People who come and see me tend to want to see me and are interested in making changes. A lot of people in addiction psychiatry have a research background as well. So that can certainly be something that's very useful. Addiction psychiatry can be quite competitive. It's a small specialty, so there's only a few consultant posts nationally. So if you've made a commitment to do addiction psychiatry, you can wait some time before an addiction post comes up that's suitable. It's not a specialty that people fall into, it's a specialty that people choose. So there is an element of competition from that basis. There's quite a lot of media interest in drug and alcohol psychiatry, and that's something that I've got into as my career's progressed. The media are often interested in drug and alcohol related stories, and once you've got a reputation for engaging with the media, they will tend to phone you up regularly and want you to give opinion on various subjects. And I find that quite interesting and appealing. I find that a very interesting part of my specialty.